Dr. Mads Gilbert is a Norwegian emergency physician and author. He has worked in Gaza over the last 20 years, including at al-Shifa hospital. Following the October 7th attacks, Dr. Mads was denied access to Gaza by the Israeli army. He joins me from Tromso in Norway. A very warm welcome back to Al Jazeera. We have, of course, spoken to you quite substantially over the past year and very, very keen at this important milestone when it comes to the destruction of al-Shifa to get a sense from you of what it all means. Of course, this was an important part of Gaza's entire medical structure, infrastructure across the Gaza Strip. What did the hospital mean, in your eyes, Dr. Mads, to the people of Gaza?
Well, as you said, Shifa Hospital or Shifa Medical Complex was the beating heart of Gaza. It was the university hospital, the flagship of Palestinian healthcare, built systematically up to be a very high-level university hospital, quality hospital with all specialties, large numbers of doctors, nurses, and all the different equipment you need to perform high-level medical services. And it was completely ruined, destroyed, smashed. The Israeli occupation forces went about with a rampage to destroy MRI machines and all types of medical equipment. So it was actually completely destroyed. And I talked to the Minister of Health in Gaza, Dr. Youssef Abarish, last night, and he said, quote, the destruction of Shifa was not only the destruction of health facilities, but the killing of hope in life in Gaza, unquote. And this is precisely the psychological goal of the Israeli occupation forces with their attacks on healthcare in Gaza, which of course has no military meaning. It is to undermine and to kill the willingness to resist the occupation and the colonial plans of Israel. Because healthcare is a cornerstone of public feeling of safety in a society. So by attacking healthcare, ambulances, and killing healthcare workers and diminishing the capacity, and on the other side, producing hundreds and thousands of needing people through the bombing and through all the diseases that are imposed by the siege, they are actually undermining the will of resistance in the people. So the attack on Shifa had a major impact on the healthcare capacity in Gaza. But on the other hand, let us not forget that they have actually reopened the emergency department in Shifa. They have reopened a few operating rooms, 3 operating rooms. They have about 40 doctors and 70 nurses working there to provide healthcare. It's unsafe, the access, they don't have ambulances, but this willingness to restore function is an amazing and impressive capacity with our Palestinian colleagues in Gaza, which needs not to be forgotten because they do not give up.
This is a facility you know particularly well. You've spent time there before the current conflict and during it as well. This facility had weathered previous Israeli mass casualty events, but at what point did you realise that the Israeli response was going to be wholly different this time? It was going to be more devastating than ever before.
Well, it was when, like all others, I saw the videos of the massive attacks on Shifa, the shooting, the bombing, and finally the burning of the brand new surgical block, which was left burned to ashes. But then at the same time, only the day after, you saw people starting to clean up and to get rid of the broken glass and try to find spots. And within a very short time, they had actually reopened the dialysis unit, which is currently functioning. And they have also opened parts of the emergency department, as I said, and they are now trying to rebuild the obstetrical and gynecological department. But the Minister of Health also underlined that there is no building material available for the restoration of what can be restored of the medical facilities, both primary healthcare and the hospitals. But I'd like to underscore that these attacks continue, in particular in the north. As your reporter stated, the siege of the north have been going on for more than 40 days. And 4 days ago, the Undersecretary of Human Rights in the UN reported to the UN Security Council, Ms. Joyce Manoya. She said conditions in Gaza are unfit for human survival. And she continued, the daily cruelty we see in Gaza seems to have no limits, unquote, pertinent to the situation in North Gaza, where Kamal Adwan, Al-Auda and the Indonesian hospitals are under continuous attacks and siege, while at the same time receiving new loads of patients from the bombing. This has to stop. And the only medical solution to the situation now is an immediate and lasting ceasefire and an immediate opening of Gaza, an end to the siege of Gaza, which are causing thousands of lives that we do not record because they are dying from infections, from maltreated or untreated diabetes, from cancer, psychiatric disorders, who cannot be treated because the healthcare system is broken down by the Israeli occupation forces systematically.
It is a protracted story of suffering and devastation, but also resilience. Dr. Mads Gilbert, thanks for joining us.
And it's all 100% man-made.
100% man-made. Thank you for your thoughts. Dr. Mads Gilbert there.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.